And then we'll come back at what time? 10:40 for reconvening.
Well, we're going to continue into a very closely related topic. We're calling this next session Healthy Communities, and we're going to look at buildings and their surroundings and how that impacts the psychosocial and health outcomes of people. Our examples are going to be specifically for office workers and healthcare and some senior living settings. And we're going to look at access to nature, biophilia, lighting, stress, those sorts of things. And I'm very happy to introduce our first speaker. We're very glad to have Brooks Rainwater here, who's the Director of Public Policy for the American Institute of Architects. And he's leading their public policy program, focusing on design-centered policy at the key intersections of cities, sustainability, and health. And he'll talk to us about the policy link, which is another important area that we need to think about as we move forward from today's discussion, and how do we get this whole discussion into a more sustainable format. Thank you.
Good morning, everyone, and thank you for inviting me to join you all here today. At the AIA, we're incredibly focused on the positive impacts that design can have on public health. And so today I'd like to talk about healthier communities through design. And two specific programs that we have right now, all kind of under the guidance of our health and leadership group that we've put together at the AIA. Local Leaders, Healthier Communities Through Design is part of a larger report series that we've done researching livable communities, sustainability since 2007. And this is the 7th report in this series. And in this one, what we really focus on are what are those positive public policy impacts that can happen at the community level? What can we do in cities to kind of meld design and health for those outcomes that we're looking to see? And the foreword was written by Dr. Richard Jackson, who's worked with us for a number of years. And I think what he says here really kind of captures the message that we're talking about today. Health and buildings are forever connected. The links between architecture and well-being are richer than merely affording safety from injury. Buildings can be, should be, agents of health: physical, mental, and social health. And so we focus on 4 key areas within the report. First, we want to demonstrate how architects can design healthier communities. We want to draw on the relationship between the built environment and well-being, because the well-being side is incredibly important. And then we want to focus on the positive economic benefits of healthier design, looking both at the individual level as well as the economic impacts of healthier design at the community-wide scale. And finally, we want to show that public policy choices make a difference. And we do this through a series of case studies. We look at 8 different cities throughout the report, and for time constraints, I'll briefly go through 3 of them. In New York City, we looked at the innovative urban design that's happening within the city. The High Line is a key example, and active design guidelines, which are kind of looking at both the building scale and then moving out at the community scale. And I know Joyce spoke about this as well. In Los Angeles, they're really doing a lot right now to advance active mobility and healthier growth. And it's exciting to see, because kind of what they're doing is stitching back this sprawling community and using programs like the PLACE program put forward by the Public Health Department to really kind of integrate the different departments and focus on complete streets and other policies that are working quite well. And then in Nashville, there's a firm commitment to be the healthiest city in the South. And the mayor down there, Mayor Carl Dean, is really spearheading this initiative by challenging community members to walk 100 miles last year. They're really putting a lot of money into it. This project here, the Gulch, is a LEED ND project where people are able to live, work, and play downtown. The other area that we're working on within the AIA is our Clinton Global Initiative Commitment to Action. This is called the Decade of Design. It's the Global Urban Solutions Challenge, and it seeks to enrich global growth and far-reaching urban policy and focus on creating great cities by leveraging design thinking, technology, and community participation. And so there's 2 areas within this. In 2012, we gave out $40,000 in research grants, along with the Association for Collegiate Schools of Architecture, to 3 universities: Texas A&M, the University of Arkansas, and the University of New Mexico. In Texas, they're looking at the health effects of a transit-oriented development community. And they're really trying to kind of look at the health metrics of people that move into that community versus others living in the city of Austin. In Fayetteville, the city is slated to double in population by 2030. And so they're creating a long-range food scenario planning process where they're looking to kind of bring in urban farming and other local food. And finally, in the University of New Mexico, we offered them kind of seed money for a larger program they're creating, which is a cross-disciplinary curriculum between the public health and architecture program there that's going to be focused on healthy community development. And the final part of Decade of Design, which we're really excited about, is a partnership with MIT's Center for Advanced Urbanism. And it's a project called Health and Urbanism, where we're going to go in for 10 years and work together with a city and an entire metropolitan region to basically research by identifying and beginning in-depth research on that metropolitan region, collaborating directly with community leaders, the politicians there, community-based groups, business, public health officials. And then we're going to find those design and policy solutions. We really want to find out what works best that can scale up both nationally and globally. We want to demonstrate by activating those ideas with demonstration projects in the city. And right now, we're really seeking out partners to make this happen, and we're very excited about the potential it has. Because in the end, what we're trying to do is design healthy, resilient, sustainable cities. And we really see these as health-promoting, transit-oriented, livable, and walkable. Thank you.